Scalp cooling has been used in one form or another for the past few years to help some cancer patients preserve their hair. But those devices were limited to certain patients with breast cancer only.
Well, now doctors say cooling is effective for people battling a wider variety of cancers. Shelley Botot has more in Healthwatch.
For patients undergoing cancer treatment, certain chemotherapy drugs can cause a big change in their appearance, like losing their hair. A therapy originally approved for breast cancer patients can now help people fighting other forms of the disease. Inside this small suitcase,
this is the silicone cap that goes on first,
are all the tools Terry Buckler needed to save her hair while she was undergoing the treatments designed to save her life.
A regular 3D mammogram caught this cancer. I could not feel anything. The doctors could not feel anything.
Terry needed chemo followed by radiation with a drug that would cause hair loss. It's one side effect her doctor had a solution for.
They're dealing with so many different things. If you can take that off their plate, that's a good thing.
A silicone cooling cap with gel covered Terry's scalp. Another cover kept it snug.
There we go.
Nurses connected the cap to the Paxman cooling system. It lowers the temperature of the scalp, causing the blood vessels to constrict.
That prevents the chemotherapy from getting to the hair follicles and can reduce the amount of hair loss.
The procedure was approved for just breast cancer patients until earlier this year. In addition to breast cancer, the FDA has now expanded its use for patients with ovarian, colorectal, and prostate cancers. From Terry's first to her last chemo treatment, most people couldn't see the difference.
I never used a scarf. I never covered my head. I was always able to style my hair to where if there was a small bald spot, I could hide it.
Preserving peace of mind during a tough treatment to restore a patient's health. Cooling systems are still not FDA approved for pediatric patients, patients with leukemia or blood cancer, head and neck cancer, and some skin cancers. It is also not covered by insurance. Terry says the cap cost $500 and each treatment was $200 out of pocket. She needed 4 chemo treatments. And that's your Health Watch. I'm Shelley Botot, Local 5 News.